As a neurosurgeon on call, there's one of just a handful of things that get my heart rate going in the middle of the night, and one of them is a large epidural hematoma. You probably heard someone say in your lifetime, don't let them go to sleep if they had a head injury, and make sure you keep a close eye on them. If you get hit right here in the head, you can lacerate the artery under the skull, and that will cause an epidural hematoma. Don't get me wrong, subdurals are also scary, but don't hit the same. Let's discuss the difference between an epidural and a subdural hematoma. They're both equally as scary, but can behave very differently. A subdural hematoma is located between the brain and the dura, and is classically caused by a bleeding vein which oozes very slowly. That's in comparison to an epidural hematoma, which usually is the result of a skull fracture that tears an artery located between the skull and the brain, and arteries can bleed fast. In that video example, I gave a patient with a GCS of 14, which is a fairly lucid state. That means the patient's awake but just slightly confused. But you have an epidural versus a subdural, or a fast bleed versus a slow bleed. A patient with an epidural hematoma can go from talking to you to almost brain dead within a matter of minutes. I've had many patients deteriorate right in front of my eyes, and remember that time is brains. Getting them to the operating room as soon as you possibly can will save their life. That's why I'm jumping my butt out of the bed. Once the patient is in the operating room, we first make an incision to expose the skull. Then use a drill called a perforator to make several holes in the skull. We then switch out the drill bit and interconnect those to remove the skull. We can evacuate the blood clot and stop the bleeding artery. And that, my friends, is why we say it's a beautiful day to save lives.